Identify the tag structure. Gabby here from bootcamp.com, and here we're going to be discussing some of the more intrinsic muscles of the larynx. So in this particular dissection, we're actually looking at a lateral view. So we're looking along the right side of the larynx as well as the trachea. So we can see right over here, we have the C-shaped cartilage rings that essentially form the trachea or part of the airway. And right over here is where we're going to find specific components of the larynx, including the laryngeal cartilages. So immediately superior to the trachea is where we're going to find the cricoid cartilage. And we know this is the cricoid cartilage because the cricoid cartilage is a lot more larger along its more posterior surface compared to its anterior surface. So that being said, this is going to be posterior and this is going to be anterior. So immediately superior to the cricoid cartilage, we're going to be able to find the thyroid cartilage, which has been reflected. And then immediately superior to that thyroid cartilage, we're going to be able to find the hyoid bone. So the hyoid bone sits and floats in the neck, and it essentially serves as an attachment point for a bunch of different muscles that are found in the neck and some membranes that actually form attachment points between that thyroid cartilage. And you could also use the hyoid bone to also help you orient from anterior to posterior. So along the anterior surface, we're going to be able to find the body, and we're also going to be able to find these small little horns that stick up just at the top. So now that we're oriented and we understand what we're looking at here, let's talk about some of these muscles that are found in the larynx. So the nice thing about the muscles of the larynx is that they're actually named based on their attachment points. And most of these intrinsic muscles are going to go ahead and attach to one of the few cartilages. So we already mentioned the thyroid cartilage, we mentioned the cricoid cartilage. What we haven't mentioned yet are the two arytenoid cartilages that actually sit posteriorly directly on top of that cricoid cartilage. So we have two arytenoid cartilages that sit side by side. So all the muscles of the larynx are going to go to attach, so they're going to insert or originate along those cartilages. So most of the muscles of the larynx are going to go and originate and insert on these cartilages. And by doing that, and when these muscles contract, it causes the movement or the shift of some of these cartilages or of the actual vocal cords that attach directly onto those cartilages. So we're first going to start superiorly. So we can see a muscle here that originates along the thyroid cartilage and will eventually go ahead to insert along the arytenoid cartilages. So remember, as I mentioned before, how the muscles are essentially named based on their attachment points. So because this one goes from the thyroid to the arytenoid, this muscle is going to be the thyroarytenoid muscle. As we move more inferiorly here, we're going to be looking more on the posterior wall. We can see some of the lateral side of the muscle, but the muscles are generally found on the posterior surface of the cricoid cartilage. So this muscle is going to attach directly onto the cricoid cartilage, which we can see here, and eventually will go ahead to attach along the arytenoid cartilages. So because this muscle is found posteriorly and based on its attachment points, this muscle is going to be referred to as the posterior cricoarytenoid. And then lastly here, our tag muscle, again, we can see this one traveling from the cricoid cartilage all the way back to the arytenoid cartilage. And along with detachment points, instead of being found posterior, like the posterior cricoarytenoid, this muscle is actually going to be found on the more lateral surfaces of the larynx. So because of its position and the attachment points, this is going to be the lateral cricoarytenoid muscle. Now, before I leave you off here, I just wanted to point out this nerve that goes to innervate these intrinsic muscles of the larynx. I want you to pause for a second to think which nerve innervates these muscles. So this nerve is going to be traveling from the thorax back into the neck towards the larynx. So this is going to be the recurrent laryngeal nerve. The recurrent laryngeal nerve, somewhere around this area, will actually start becoming the inferior laryngeal nerve. And the inferior laryngeal nerve is the nerve that will provide motor innervation to these muscles, including that lateral cricoarytenoid. So if we just go back to our question here, so identify the tag structure. So because it is found laterally and attaches onto the cricoid and then the arytenoid cartilages, this one specifically is going to be the lateral cricoarytenoid.